Culture encompasses the integrated patterns of human behavior, including language, thoughts, actions, customs, beliefs, values, and institutions that connect and define a group of people. Understanding culture is the base of communication. It's what we build our interactions and relationships on. Without knowing cultural differences, our communication can fail, leading to misunderstandings and missed chances to connect. As a medical interpreter, I've seen how culture affects health and healthcare. In my work, I've noticed how cultural beliefs and practices change the way symptoms are described and the treatments people prefer. Culture shapes our beliefs, values, and actions. It affects how we see illness, how we seek help, and how we follow medical advice. Culture is like a colorful fabric made of language, traditions, customs, and shared experiences. Each part adds to the rich diversity of human life. Think of culture as a lens through which we see the world. This lens changes our views and shapes our interactions, guiding us in how we understand and react to the world. This lens shapes how we understand health, illness, and the doctor-patient relationship. It affects trust, communication, and the quality of care. For medical interpreters, understanding each person's cultural lens is crucial. They must handle not only language barriers, but also cultural differences to ensure clear and caring communication. This understanding goes beyond just knowing the language. It requires knowing cultural context, social norms, and the unspoken rules that guide interactions. It involves recognizing nonverbal communication, respecting social ranks, and understanding the cultural context of health beliefs. Nonverbal cues can often say more than words, showing respect, empathy, and understanding. In short, understanding the impact of culture is the first step to building understanding and providing culturally sensitive care. By embracing cultural diversity, we can create a more inclusive and effective healthcare environment for everyone. Cultural competency in healthcare means giving good and respectful care to people from different backgrounds. It includes understanding and meeting the needs, values, and beliefs of patients from various cultures. It's about knowing that one way of doing things doesn't work for everyone. Each patient has their own cultural background, which affects their health beliefs, practices, and how they like to communicate. Culturally competent healthcare workers try to understand their patients' cultural views and adjust their communication and care. This means being aware of cultural differences and being flexible to meet each patient's needs. This involves asking open-ended questions, listening carefully to patients' concerns, and being sensitive to cultural differences in communication. It's about building trust and respect with patients by valuing their cultural backgrounds. For medical interpreters, cultural competency is a must-have skill. They play a key role in making sure communication between healthcare providers and patients is clear and effective. They act as important go-betweens, helping to bridge the cultural gap between healthcare providers and patients. Their work helps to avoid misunderstandings and ensures patients get the care they need. Their role goes beyond just translating words. They also help explain cultural meanings, making sure nothing is lost in translation. This helps create a more inclusive and effective healthcare environment for everyone. Interpreter tips for working with different populations. Learn the specific patient needs. Hold a brief introductory discussion or a pre-session. State your first name and reassure all parties about confidentiality. Clear communication in healthcare is very important. Ask all parties to speak in short phrases to allow the interpreter to be able to provide an accurate interpretation. When patients and doctors understand each other, it helps with correct diagnoses, good treatment plans, and better health. Clear communication builds trust between patients and doctors. It helps patients take part in their own care, leading to better following of treatment plans and better health. But poor communication can cause big problems. Misunderstandings can lead to wrong diagnoses, medication mistakes, and a lack of trust in healthcare. Medical interpreters help make sure language barriers don't stop people from getting good healthcare. The LGBT+ community includes people with different sexual orientations and gender identities. Sexual orientation is a person's emotional, sexual, and/or relational attraction to others. Usually classified as heterosexual, bisexual, and homosexual, for example, lesbian and gay. Sexual orientation describes how people locate themselves on the spectrum of attraction and identity. It is different from gender identity or gender expression. Transgender people exhibit the full range of sexual orientations, from homosexual to bisexual and heterosexual. Here are some LGBT terminology for our cultural awareness. Bisexual is one whose sexual or romantic attractions and behaviors are directed at both sexes to a significant degree. Bisexuality is a distinct sexual orientation. MSM, men who have sex with men, usually identify as gay. WSW, women who have sex with women, usually identify as lesbian. As gender identity, we must learn that the term transgender describes people whose gender identity and/or expression is different from that typically associated with their assigned sex at birth. Genderqueer describes people who sees themselves as outside the usual binary man-woman definitions, having elements of many genders, being androgynous or having no gender. There is also a gender non-conforming, GNC big ender, describes people whose gender identity encompasses both male and female genders. Some may feel that one identity is stronger, but both are present. MTF stands for male to female, a person who was assigned the male sex at birth but identifies and lives as a female, also known as a trans woman. MTF are persons that will still need to have prostate exams according to standard guidelines. FTM refers to female to male, a person who was assigned the female sex at birth but identifies and lives as a male, also known as a trans man or trans male. FTM persons will need to have breast exams and pap smear tests according to standard guidelines. Transsexual is the medical term for people who have used surgery or hormones to modify their bodies. Some trans people find this term offensive. We do not mean to disrespect or offend anybody. It's important to treat LGBT+ patients with care and respect, making them feel safe and welcome. Medical interpreters should know LGBT+ terms and understand their health needs. For example, transgender people might need special care related to their gender change. Using inclusive words, respecting patients' names and pronouns, and making them feel welcome are key steps in good care for LGBT+ people. By creating an understanding and respectful environment, healthcare workers and interpreters can help reduce health problems and make sure everyone feels safe getting medical care. Section 5. Navigating New Beginnings. Healthcare for Refugees and Immigrants. Refugees and immigrants may not be familiar with the U.S. healthcare system, experience illness related to life changes, practice spiritual and botanic healing or treatments before seeking U.S. medical advice. Refugees and immigrants often have a hard time getting health care. Language problems, cultural differences, and past trauma can also make it tough on them. Medical interpreters help solve these problems. They help refugees and immigrants understand the healthcare system and get the care they need. Interpreters who know about refugees and immigrants can give great support. They help patients talk about their symptoms, understand their health issues, and learn about treatments. By giving care that respects their culture and language, we can help refugees and immigrants live better and healthier lives. Section 6. Helping the Vulnerable. Interpreting for seniors and individuals with disabilities. Seniors and people with disabilities need special ways to communicate. Hearing problems, memory loss, and health issues can make talking hard. Interpreters must be patient, kind, and good at changing how they talk to help each person. They might need to talk slowly, use pictures, and watch for body language. Common health problems are arthritis, heart disease, dementia, and trouble moving. Knowing about different cultures helps interpreters understand how people deal with these health problems. It is also important that when interpreting for seniors and individuals with disabilities, medical interpreters should consider to face patient at all times, speak slowly and enunciate clearly, do not use contractions, rephrase if necessary, do not cover your mouth, and try to reduce any background noise if possible. Section 7. Cultural awareness. A key to reducing health differences. Health differences, the avoidable gaps in health between different groups, are a big problem. Knowing about different cultures helps fix these gaps and makes health fair for everyone. By learning about the cultural factors that affect health beliefs, actions, and access to care, healthcare workers and interpreters can better serve different groups. This means dealing with language barriers, cultural misunderstandings, and unconscious biases that can cause health differences. By understanding and respecting different cultures, we can create a healthcare system that is fair and high quality for everyone. Section 8. The Ongoing Journey. Continuing Education and Cultural Humility. Learning about different cultures is a journey that never ends. It means always trying to understand more about other people's ways of life. Medical interpreters need to keep learning to do their job well. They should look for new information and experiences to help them understand different cultures better. This means reading the latest research, going to workshops and conferences, and taking part in professional development. It's also important to learn from people from different backgrounds. This helps interpreters understand cultural differences better. Cultural humility means knowing that we don't know everything and that we can always learn more. It means being open to learning from each patient's unique cultural perspective and being willing to think in new ways. By always learning and being humble, medical interpreters can give the best care to all patients. This helps build trust and improves patient outcomes. In the end, continuing education and cultural humility are about trying to be better every day for the people we serve. Section 9. Join the talk, your voice matters. Working together helps us understand different cultures in healthcare. Everyone has a part in making healthcare fair for all. Share your thoughts and stories about cultural understanding in the comments below. Let's talk, learn from each other, and make healthcare better for everyone. Your voice matters. Please like our video, share it, and subscribe to our channel. Thank you for watching, and until next time.